Good morning. This is the House Appropriations Committee. It is Thursday, April 3rd, 2025. It is 9 a.m. and we have committee time today, which we didn't yesterday, but we all have cleaner desks today, so that's a nice thing. First up, we'll have the Secretary of Administration and the Secretary of the Agency of Human Services to talk to us about budget adjustment and impacts of not having one, so we all understand where we are. After that, Erica McKellar, who is our liaison with the National Conference of State Legislatures, NCSL, is going to come and chat with us, tell us a little bit about what she does, and answer questions about things that they can do or can they or not. And then we'll have a couple of other things that are going to happen off live. I think I'd let you know we will be getting the education bill in this committee next week when it's in our possession. But before then, because it's such a big bill, I'm working on getting people to come in and talk first about the policy piece and then about the education funding formula piece. So we've been able to get Beth St. James is going to come in today at 3 o'clock to talk to us about the policy piece that's in H454. And then this morning, Tammy Colby is talking to House Ways and Means about the education funding formula. And I'm hoping to get Julia Richter to come in at some point, not today, hopefully tomorrow, sort of TBD at this point. But I think what we will do is we'll have Thursday afternoon at the movies, and we'll show Tammy's testimony this afternoon after the floor. So those who want to can come and watch that. And so we'll have an idea of what's happening, and then we'll have somebody come in and talk to us about it when we can arrange that. But they're kind of flat out in that committee all day, every day. So I have to get their permission to excuse people who need to be working on the bill to come talk to us. So we'll see how that works. But I thought that would be a helpful way to do that. So after the floor and before 3 o'clock, when Beth St. James comes in, we'll do that. And then we'll see how that all works out tomorrow. So that is today's plan. And so if we can have both secretaries, Madam Secretaries, what a nice thing to say. Is Madam Secretary a TV show?
It was.
Yes.
It was.
Am I dating myself?
No.
She was Secretary of State.
Yeah.
Well,
Then she became
you
president.
kind of almost are, but between the two of you, this agency and the whole administration. So we really appreciate you taking the time to come. At the end, before you leave, I just want to chat with you about what we're thinking about federal funds issues going forward, but I didn't want to confuse the conversation. So I'll fill you in on that at the end of our conversation. But if you want to introduce yourselves, and then we can talk about the impacts of BAA.
Sounds great. I'm Sarah Clark. I am the Secretary of Administration.
And I'm Jenny Samuelson, the Secretary for the Agency of Human Services. Thank you for having us.
Thank you for coming. And this is really kind of a conversation. We have questions. You may have things you want to let us know as well. So this is not an interrogation. This is us trying to understand, what's happening. So as you know, the first BAA is sitting on our wall. The second one is on the floor.
Yep. Yeah.
Of the Senate, while they're also trying to do markup on the budget for next year. So it's kind of a crazy year that way. But we know there were things that were in the Budget Adjustment Act that are time sensitive, cost money. And so just are very interested in understanding how that's going to work if we don't have one. And I expect that, most of them, Secretary Samuelson, are in your area. A lot of it's Medicaid. There's global commitment. There's general fund money. There's $24.5 million for 78,000 bed days. That's part of the Medicaid. There was 10 million in provider stabilization. There was 21 million for emergency financial relief for nursing homes. So those are just a few that are sort of off the top of our heads, but they're kind of big. And tell us about what might happen or could happen.
Great. Well, thank you for the opportunity to let us come in and talk with you about our preference is for a clean bill that we can all agree on and pass, and that we'd have a budget adjustment. I think we can all agree on that. I think it's important to the operations of state government to make sure that we're able to provide core services to Vermonters. I think think we all agree that would be our preference, but understanding right now we are at a policy impasse in the budget adjustment. And so we remain optimistic that we can get there with a budget adjustment, but we've also started planning what we'll do if we don't have a budget adjustment. And so, and we'll talk about federal uncertainty, I think at the latter half of this.
Yes.
You know, that I think is weighing on all of us as we kind of navigate our path forward with budget adjustment. So myself and my team are working with Secretary Samuelson, Commissioner Gresham, and others across state government to develop a path forward without a budget adjustment. To be clear, I think we can come up with a path that will get us through closeout. It'll be complex. It won't be easy. It'll be very challenging for financial offices across the state. And I want to make sure everyone understands we will need the funds at some point, right? So whether it's in budget adjustment that's on the wall or over in the Senate, another vehicle in the C section of the big bill, the funds will be needed at some point. But we do believe that we can develop a plan that will support the core functions of state government through the end of the fiscal year, through the mechanisms that we have available to us. And that's the kind of very specific path and plan development that we're working very closely with the Agency of Human Services, because you're correct, Madam Chair. That is in large part where the biggest challenges are. And no surprise and not different than any year due to the really important work that the Agency of Human Services does for all of Vermont. So saying that, I'll talk about what some of those key pressures are that we would be planning to develop a path forward to get us through closeout, and also talk about what are some of the things that we wouldn't be able to handle in that kind of make it work path. And that would be things that we wouldn't be able to execute upon until we had the funding. So and Jenny can certainly add lots of details here, but really you hit the nail on the head with the Medicaid program. And that's the core service that we would need to be able to fund through the end of the fiscal year. And that's going to involve several departments at the Agency of Human Services, including DEVA. As you're aware, the budget adjustment included funds for caseload and utilization pressures that DEVA is facing, as well as the Accountable Care Organization reconciliation payment. Those are all things that we would be looking to develop a path forward to get us to June 30th. The same at Dale. There are funds needed for nursing home bed utilization, as well as for the ASPE collective bargaining agreement. And then at DMH, there's funds needed for private non-medical institution support. So those are the things that Jenny's team and Secretary Samuelson will be looking to develop a path forward to June 30th.
So I just want to be clear on those last couple items you mentioned. They can wait until mid-May or late May, or they can't wait to mid-May or late May.
Those are the areas that we are going to be working on a path to get us to June 30th, absent of a budget adjustment. And it'll involve a lot of, I'd say, accounting maneuvers to get us there. Complicated, not best practice, but things that we can do to be able to close the year out absent a budget adjustment.
I mean, would your recommendation to be to do a third BAA? Or, you know, that was just a few items or an amendment to another moving bill? I mean,
yeah, I mean, I think our recommendation would be a clean BAA, which actually the one that the Senate is taking up for third reading today, with the exception of the hotel motel program, I would consider a clean BAA. And so there is on the Senate calendar today, there is an amendment that's being offered that would align that section of the budget adjustment to what the governor's proposal was during our negotiations, as well as it aligns with the executive order that was issued on Friday related to the hotel motel program. So either a clean BAA without the policy changes, or one that amends to align with what the governor issued on Friday.
John, and then I have some questions too. Go ahead.
I know you're kind of thinking about working on a plan to move things forward here to the end of the fiscal year here. There's kind of a date by which you have to kind of activate the plan if you don't come to some agreement.
Yeah, I think, I mean,
Not to put you in a spot to say, gee, at this date here, but.
I think we would be, yeah, we'd be
We're beginning,
now.
we're
Yeah.
beginning to activate this plan now. These are core areas, like our Medicaid program, in which we need to make sure that there is sustainability.
Yeah, can't wait. And it's really, I'm uniquely positioned as former CFO of HHS. I'm uniquely positioned to understand how incredibly hard this is going to be for that agency. But we want to make sure that we're able to provide for those core services. And so that's Medicaid through the end of the year without a budget adjustment. And so the other big area outside of,
Oh,
sure.
Concern to me that this is getting delayed this far out here, because there's kind of a point in time, it really needs to impact on everything that you're agending here clearly.
Yeah. I mean, we are already in the process of putting in place what's necessary. The delay in BAA is going to cause administrative complications for the agency, which is not efficient. And as Secretary Clark said, is also not best practice. It will likely also cause delays in commitments that the state has made to providers like the Brattleboro Retreat for their reconciliation. And so I share your concern that there is a delay, and I'm hopeful that we can get to a place in which we can get to a clean BAA that is reflective of budget adjustment versus policy.
Thank you.
Before you switch topics, Sarah, I'm wondering, so you've talked about, you have maneuvers or whatever, but so what are the kind of tools that you can employ specifically to make this happen?
Sure. And to be clear, we don't have everything laid out, what we're going to do. But there are mechanisms that get used, quite frankly, routinely every year as part of closeout, and actually throughout the year, in terms of the ways in which agencies and departments can adjust their budget kind of outside of the legislative process. And so it'll likely include a combination of things like excess receipts requests, which I know this committee is familiar with. And they're used pretty routinely. And then specifically at the Agency of Human Services, every year closeout at AHS is like none other in state government. And I have worked in a variety of places, so I really am able to say that. And AHS, as part of the closeout of the Medicaid program, uses their authority as part of the global commitment transfer process to move money
Between departments.
Yes,
Yeah.
to support the Medicaid program at large. And so that's what, those are the main tools that we would be looking to do, with the understanding that the money will be needed at some point, but that if we had to, if there was no other option, that's what we would do, working in collaboration.
Yeah, we would essentially borrow general funds between departments to be able to gross up for GC. But that is, as Secretary Clark said, a very temporary maneuver. And so we can get through to the end of closeout, but we would be looking first for resolution in order to go back and address what we've done.
Sure. So totally understand, we would all like to get resolution, but we're just sort of saying, well, so what are the worries that we should be having if we don't have one? So I'm wondering how, if you're doing these sort of accounting gymnastics, how that might impact your audit.
So I think that's a great question. And I think it really depends on the timing of when funds were provided. And so, and I don't want to problem solve, I don't want to get into the weeds because things could change. But ideally, the closeout the drumbeat of closeout really starts, I'd say, early June.
Okay,
And so the agencies and departments statewide, start working on all the things that they have to do to close out this fiscal year successfully. But really, like, it doesn't officially end until mid-July.
yeah,
And so, and AHS in particular, a lot of the kind of hard work and meetings happen in that first 2 weeks in July.
uh-huh,
Not to diminish what happened, everything that leads up to
oh, sure.
first 2 weeks in July is a lot. But ideally, we'd have the appropriations made in sufficient time to be able to get everything right on the accounting books before closeout actually occurred.
Okay, so, yeah, so when an audit comes in, but they might see that you had to do this, would it impact our bond rating at all?
I think if we were able to successfully close out the year the way that we intended, ultimately, I think it would be fine. I think what could impact bond ratings is, as you are aware, Vermont gets really high ratings from the agencies because of our financial management. And so I think to the extent that we are not able to kind of come to agreement, I think, that could influence, their perception of our strong financial management practices.
Thank you, go ahead, Lee.
Is it possible that any fallout could come out of DC during this period of time that could cause complications that are unforeseen now? And could they be severe, and how, and what nature would severity be?
Yeah, I think, as you know, I've been in here to talk and things keep getting more real as it relates to federal activity. I think, we are still trying to take a level approach and assess information as it becomes facts, as we are made aware of it at the federal level. Saying that, could there be something that has a real impact this year? Potentially.
Sarah, is it also fair to say that as we look at what we're talking about doing behind the scenes to make this work is something that we typically do for closeout every single year. That said, the not having a BAA will not necessarily give us the flexibility and the extensibility to address any of the unknowns. And I don't want to predict what those are going to be from Washington, because I think there's a real jeopardy that what we end up doing is catastrophic thinking or feeding into the chaos that's happening at the federal level. And typically, like last week, when there were cuts to public health, the impact of Vermont was much lower than the impact to many other states. And so it doesn't make sense to try to predict or, again, feed into the chaos. But what we are doing will potentially give us less flexibility to respond if there are changes. And that's why in our mind, there is real value in trying to get to a clean BAA or another mechanism sooner versus later.
One more AHS question that I have is, I forget that the vets home is actually technically under you. And so what's going to happen? There was a big chunk of money going to them. Are they going to make payroll? Do we have to worry about what's happening there?
So the veterans home, when you look at the budget, the veterans home is included in the nursing home bed utilization, where we are getting back to the pre-pandemic level of utilization. So that's $51 million. As we're talking about what we're doing to address the changes, we are accounting for that as well. So we do not expect our goal is to minimize impacts on operations for our healthcare providers and for the veterans home. Again, I think that there may be we are going to have to prioritize what we address first, and some of the elements like the Brattleboro retreat or the ACO payout for reconciliation for this year, both commitments the state has contractually made.
Right.
Those may fall later in the year than they otherwise would.
Okay. Thank you.
And Madam Chair, that was the point I wanted to add to this discussion, because though obviously there's a link between the Veterans Home and the Agency of Human Services, because they serve Medicaid patients, they are outside of the jurisdiction of the Agency of Human Services. They're kind of like a freestanding department. They're also in the budget adjustment for $6.9 million of general fund support.
Right.
So that's another area that we need to cover. In addition to the Medicaid reconciliation, the general fund pressure is another area that we will have to work very closely with them to come up with a plan to get us to June 30th without a budget adjustment. So that
They
it's,
have spending authority to do what they need to do.
they don't right now.
Okay.
But we would be working with them to establish that absence of a budget adjustment.
Do we have to give them the spending authority?
It's the excess receipts establishes
Oh,
the
okay, so
spending
you're
authority.
using
Yeah.
that. Okay,
But
good.
again, we would need the cash eventually,
Right.
right? It has to all get
That
caught.
I understand.
Yeah.
And Dave Yakavoni had a question.
Yes, I just wanted to revisit briefly the extraordinary financial relief for the nursing homes. Have you heard from any homes that cost closing because we haven't been able to front them any money? Or have you found a way to front some dollars to those providers?
So the process for extraordinary financial relief for skilled nursing facilities is in rule. And so we have continued to move forward and ensure that the skilled nursing facilities are stable. And we have not yet found any issues with being able to do that. And we don't anticipate it.
Thank you.
Okay.
Okay.
Other the areas that you're thinking of.
Great. So those are really AHS and the veterans home are the core areas that we need to make sure without a BA we can get to the end of the year.
Yeah.
Secretary Samuelson has already touched on some of these, but there are some things that we won't be able to do without a budget adjustment. And that is the provider relief payments, the Brattleboro retreat, alternative payment model reconciliation payment. The budget adjustment has some deficit mitigation, so filling some holes in some special funds. So to include the State Employee Medical Insurance Fund, the Vermont Correctional Industries Fund, we won't be able to fill those holes in, this year. We would wait until there's either a budget adjustment, C-section of the big bill.
Yeah.
However, we would want to handle that. And so those are the things that we wouldn't do, right? We would just wait.
And can I provide some clarification on that? Representative Yak asked about the extraordinary financial relief for skilled nursing facilities. That is in rule. But there are a number of other types of providers that what Secretary Clark is talking about is $10 million that is currently in budget adjustment to stabilize the breadth of other types of providers. As we've talked about here before, that we anticipate that may include federally qualified health centers. It may include some of our mental health providers. It's a breadth of and substance use providers. It's a breadth of organizations who previously didn't have a path for stabilization. That in this, their payments would be delayed, and that actually could put some of those organizations at risk and put access to care at risk. And so it is incumbent on the delay that will cause that.
I also remember coming across the telephone tax thing.
Yeah.
Something was supposed to happen.
Yes, something that's supposed to happen. I think we originally put it in the budget adjustment because that's typically the fastest bill out of the gates, right, if you will, not this year. And so I think we're gonna need to be looking for another vehicle for that, depending on the outcome.
So that was not an April 1st.
I think it was,
Wasn't it?
it was, it
It was supposed
was,
to repeal the telephone tax? I don't know, John, that was your area. The such.
yeah. It was, I don't have a full answer for how, A, we've handled that because April 1st was Tuesday, and B, and what we'll do.
Yeah.
Yeah.
Other areas that, Dave, go ahead.
Should we consider putting rulemaking authority broadly across the spectrum of providers so that, unfortunately, hopefully this won't happen again, but one never knows, so that the latitude would exist so that not that you would be compelled to intervene, but you could intervene? Because when you mentioned that we have the EFR and rulemaking, but not for other providers. Would that be a good insurance policy or help with the safety net?
I would need to think about that a little bit. I think it's an interesting proposal. The $10 million is one-time funds. It has not been something that we have carried in the base budget. For this year, it would not be sufficient because we would not be able to get to rulemaking in time for that. And I think you alluded to that in your question, as it being much more future focused. So I would need to provide a little bit more thought, and would be
Thank you.
happy to do that with
Let
you.
us know. Yeah.
Well, I'm wondering about other agencies, maybe outside of AHS.
Yeah, I think there are a pocket of other agencies, natural resources, the Department of Public Safety, the Agency of Education, where there are adjustments in the budget adjustment, but I view them as either less critical from a timing perspective, or we have other mechanisms to be able to meet that need to get through closeout. I think less, not to diminish what we'll have to do, but less of the complexity that AHS and I think the Veterans Home in terms of those critical core services.
One of the things that we noticed in the budget adjustment was all the increases in service levels of agreement from ADS, for example.
Yeah, I think, yeah, you raise a great point, because I think we probably would not make those payments this year. And so it carries as a deficit at ADS. And so timing of when the funds are appropriated would make those payments. And I hesitate to even say this because this is the last resort of the last resorts, is if people don't have the spending authority, then they can hold bills, which is a terrible practice. I would never advocate anyone to do that. But when push comes to shove, those are things that you can do. And that's in some ways like the SLA, the service level agreements. I mean, it's internal to state government, but it is something that we would defer until we had the funds to support. It's another thing that crosses, as you saw, many departments.
Yeah.
And that could affect our bond ratings.
Yeah. And just to be clear, I don't ever want anybody to hold bills. And like at AHS, my experience, you spend a lot of time making sure that nobody does that because it's just kicking the can down the road. In this case, the cash will come at some point. I'm confident that we will get to resolution at some point on what's needed for fiscal year 25. And so we know there would be a payback mechanism that would make these things right.
So excess receipts is, I seem to recall the federal excess receipts when we talked about it, when Richard Donahue was here, was only around 31 million. Right, so if I had that right, maybe there's other excess receipts in other places, but that doesn't seem like it's enough. I mean, are there special funds, other special funds that you would end up having to tap into and then replenish them once you had the cash? Is that how that would work?
Yeah, I think it would, that's where the complexity gets in. I think we would be weighing federal receipts versus special fund receipts and putting together the most appropriate that we can path forward.
But you wouldn't take money from special funds from like anything that wasn't part of AHS.
Yeah, no, I wouldn't expect that we would do, because it would be, I don't think we would be able to do that.
Yeah.
But that would not be the intent.
Yeah.
For sure, yes.
All right, just trying to understand how these things work.
I mean, hopefully we have a budget adjustment. That would be everybody's preference. But as we move forward, we'll know more about what we're going to have to do to accomplish this.
Okay. I know it's complicated. Yes, go ahead. Carol.
Reversions are contemplated in the BAA. And since they potentially wouldn't happen, are there ways to take advantage of those reversions not happening? And how would you do that?
That's a great question, Representative Squirrel. I think that is part of the calculus that we're looking at, is if there's a way that we could harness the reversions that didn't happen if needed to help across state government. Yeah.
And then would they happen later when they were replenished?
I don't know, right? I don't know.
That's true, yeah.
I think what this brings us, in some cases, this is uncharted waters,
Yeah.
not
Yes.
having a BAA, as we've all acknowledged, is uncharted waters.
Yes.
So just quickly back on some of the imminent needs. Part of what's in there, I think it was what, $10 million for emergency relief. And then there was additional money for nursing home. If we wait and put this in the C section of fiscal year 26, not we, the Senate, are we in risk of any of those providers going out of business before the end of May,
Yeah,
whatever it is?
I think when we do extraordinary financial relief, not the nursing home structure, but for the other providers, the timing of that relief is really important. The only reason that we consider providing extraordinary financial relief is when an organization becomes a going concern. And as a reminder, we ask every single one of them to develop a sustainability plan, because for the majority of them, we are able to identify structural issues that are causing the challenges that they've faced or one-time unexpected expenses. We will not be able to do the extraordinary financial relief in the time frame for some of the organizations that we had hoped. And that could put those organizations at risk. I can't speak to any specific case and scenario here, but there are current providers that we were planning on using that $10 million to reimburse.
Any other questions? Guys, we'll really appreciate you coming in. I'm going to just tell you what we're thinking about doing regarding federal chaos, whiplash, I'm not sure. So we have, I hope this afternoon to be sending out a letter, so you would get it and maybe your department heads and things like that, but across the state to ask people to think about the federal funds and the grant. We kind of want it's sort of information gathering. And so, what are the federal grants that you have? What is your assessment at this moment in time, recognizing it's a moment in time of high, medium, low risk? Are there FTEs associated with it, or is it an entitlement, or is there state match? So just kind of so we can get a sense. We'll have the data. Obviously, it'll be shared with you guys. So as the Secretary of Administration, you'd want to have all that information anyway. But we're trying to get a handle because we know we're going to have to be reactive, right? We can't figure out all the scenarios that could possibly happen, no matter how much time is spent. So just getting us understanding the landscape and what you all are thinking about high, medium, and low risk. And because at the end of the day, if really catastrophic things happen, we're all going to have to prioritize. And the more information we have ahead of time, so we can be saying, they're all important, but which are the most important? What will harm Vermonters more? The kind of thing will be really helpful. So we'll be asking folks to come back in to testify and give us that information. So that's a heads up. That's a different conversation than what we're having today, but want to let you know that that's what we're trying to find a work on.
It is, and I think I'd welcome the opportunity to reflect on that exercise with you, understanding your letter is going out this afternoon. We have our own efforts and approach that we're taking and really trying to limit the chaos, to try to make sure that we aren't acting until we understand the facts.
Absolutely.
Of what's happening. I think it's good to understand the lay of the land, but make sure that we're not maybe overstepping until we actually know what's happening. But I think the exercise of Medicaid, we know Medicaid, something is going to likely happen at the federal level, and to understand that.
So this is not action, this is understanding.
Understanding.
That's our point.
And I think what we are trying to get more concrete about is tracking what's actually happened. And as Secretary Samuelson mentioned, the COVID era public health grants, minimal impact on Vermont, but that's something that's actually happened. I think we all heard a little bit yesterday, was in the media, about the Agency of Education and their ESSER funds. There is still a waiver process for that. So while the initial news is, well, maybe this is, I think the figure is 15 to 17 million, there's a waiver process. So what does that mean? And so I think it's a good exercise to understand the lay of the land and hope we can collaborate and share information.
Yeah, so exactly. And, you know, I get some of us get stuff from FFIS. And so there was a lot of stuff that showed there were 5 grants that were on the spreadsheet I most recently saw. Some were not that significant, but there's a I never pronounce it right, Samsha, whatever.
Yeah,
Whatever.
same problem.
There was a big chunk that was unused that looks like they're gonna claw back. So, you know, it doesn't, if it's a $30 million one and there's 300,000 outstanding, I'm not so worried about that. But if it's a 2 million and they've taken 1.3 million back, then, you know, that's a different circumstance. So.
It's also important to understand not that I want to add on to the exercise, but as you're thinking about engaging in this process.
Yeah.
It's important to understand the activities that happen underneath those and to be able to prioritize.
Exactly.
For example, with the public health grants that were pulled back in Vermont, they don't cover for example, you've seen in the national news about it being about immunizations. They don't cover actual immunizations. They covered outreach and education efforts related to immunization. When we think about prioritizing between actual services provided to Vermonters, at least at the Agency of Human Services, and I think other agencies are approaching it, versus the nice to haves, the things that are helpful.
Right.
We're going to need to make clear decisions.
Exactly. So understanding your priorities, understanding what's underneath, what it really means. I mean, obviously that's going to be important for us to understand as well. So we're going to be getting into the weeds more than we ever thought we needed to, but that seems to be the way it's going to eventually be.
And I think to your point, Madam Chair and Representative LaRoche, getting to a budget adjustment so that, you know, our business offices across the state can kind of move through closeout as seamlessly as possible is so important, because working together, to evaluate the federal impact is going to be really significant. And we want to be able to focus on that, because I think we're going to have to, right? At some point, and that's going to be the real challenge. Most likely. Trying to be a little bit optimistic, but
some days are harder than others.
We're drawing on the same people to do a lot of this federal analysis who are going to be working on addressing the lack of a BAA. And, you know, I often, you know, think about the impact on the people, but their time is also money to the state. And so the more efficient that we can make state government, the better off we are.
I could say the same in the legislature. Mike, did you have a comment or question?
I just wanted to express appreciation. You all are juggling a lot too, and understand that we're not just talking about numbers here. Michael Bohusky was speaker. He always had a saying, "How is what we're doing going to affect Mrs. Murphy who lives across the street?" I think it's important we remember that. You know, we're all pedaling as fast as we can. So I want to show some appreciation for you.
Thank you.
thank you.
Thank you so much for coming in. We really appreciate it. We'll be in touch.
Appreciate it.
And yeah,
You won't be bored.
get through there. No, none of us are going to be bored. Read deep while you can. Thank you again.
And minimize.
So committee, Erica from NCSL will be here 10 to